Hi, it's Michelle Alton and Angela Trotta, and we're your neighborhood realtors here in Milton. And what we're doing is we're just going out and we're meeting businesses, and today we are with Dr. Ted Karolidis and his wife, Nemi, who is also, she's a hygienist herself. So, Dr. Ted's a dentist here in Milton, and what I'd love to know is, well, first of all, how did you guys get started? How long have you been here?
I've been here 20 years now.
20 years?
Yes.
Wow. Okay.
Basically, we live in Mississauga. I was looking for a practice around this area. One of the previous dentists was retiring, and I purchased his practice. So,
okay.
yeah.
I had no idea you were here that long, to be honest. Yeah. No, that's fantastic. And so what was it that made you come here? Was it because you were purchasing the business from the other dentist, or?
Yes. I kind of wanted to get away from the city as well. You know, this was, I mean, this is becoming a large town now as well.
It is,
but
isn't it?
At the time it was quite small, and
it's grown in leaps and bounds, which is you know, one of the reasons why we're doing this is because, you know, we've got clients that are coming. It's good because, you know something, I know that, well, I used to be a dental assistant myself way back. I won't even talk about that. But anyway, and I know that people can get a little nervous when it comes to being with dentists. And what would you say is, because right away I'm getting the feeling that you're pretty comfortable. You seem pretty casual with your patients. And so what is it that makes you special? What is it that makes it so special about your patients coming here?
We try and treat the patient for what their concerns are, obviously. Mm-hmm. We try and show them what we see, what they may not realize is going on in their mouth with their oral health. Yeah. And basically we discuss and work together to reach those goals, because everyone has different perceptions of what they need, or, you know, what they want to get done. So that's what it is. We try to be as friendly as possible to everyone. Yes,
I see that. I really do. And, you know, actually, that's one of the reasons why we came in, is because just from the outside, before you even come in, the fact that you call yourself Dr. Ted, right? It's, you know, it's not, you don't have the full dental name and the whole, which I think right away gives people a more comfortable feeling, knowing almost like they're talking to a friend as opposed to a doctor, especially a dentist, which, you know, is right on up there with the fears of people, right? And that really, I think that was, I like that approach, right? It's what made us come in here. Okay, so I do have a couple other questions for you.
Alrighty.
And that is, what was it like when you first started here? When you first, 20 years ago, do you even remember? It was so long, I mean, you've got so much experience here.
Yeah, well, I mean, when we first started, it was quite slow.
Yes,
had to build up the clientele, but you know, through reference, you know, people,
word of mouth,
word of mouth, things like that. We built it up, and sort of where we're at right now.
Yeah. And do you have a lot of patients in your practice?
A couple of thousand, I think.
Wow.
I'm not sure. Yeah.
Wow.
I'd have to check it out. But
well, they must be doing something right? Yeah. Okay, so let's see. I mean, being a dentist, you're a business owner yourself, right? Yourself and Nemi. Yeah. So what have you found has surprised you the most about being an entrepreneur?
A lot of paperwork. A lot of government regulations.
Oh, yeah. That's on top of the dental regulations that you strictly have to follow and all of that.
Yeah, those, I mean, that's for the patient's, you know, well-being and everything. Yeah. So, but again, I find very stressful with all the non-dental things that I have to take care of.
Yeah,
you know.
I agree. Especially if you're not a paperwork person.
Yeah.
I mean, there are some people who thrive with that, but
no.
You know,
I enjoy working on the patient, dealing with the patient.
I guess that's the really important part, though, isn't it? Right? As long as you're good at that, right? The rest of it, you know, it's not as important. Okay, so let's see here. Do you have any exciting plans for your business?
No, maybe just do some minor renovations here. And,
okay.
You know, just
yeah.
give it a little facelift or whatever. Nothing major though. I mean, it's worked fine for us all these years. And
yeah, with 2,000 patients, I would think so.
Yeah, it's.
Wow.
Yeah.
That's all right. Great.
Can I ask a question, Dr. Ted?
Yeah.
You may.
It's really important, especially nowadays, for people to get after-hour treatment.
Yes.
Could you just tell our viewers what your hours are so they know whether or not, you know, the after hours could be accommodated any days or Saturday?
So we have certain set hours, certain set days. They vary. You have to go to my website to see. It's miltondentist.ca, and they vary. Sometimes, like Fridays, we're usually only open in the mornings.
Right, okay.
And even then, we'll see patients maybe every other Friday,
Okay.
but it's by appointment. Any emergencies, obviously, we try and accommodate them the same day. After hours, it can be a little bit more tricky. It depends.
Yeah.
Usually, patients of record will, you know, obviously do whatever we can to accommodate them. But I'm always available. I leave my cell number, you know, as an emergency contact. If anyone has any problems, they can always contact me. We can always work something out.
Yes.
Yeah, I can't promise I'll always
can
always be here.
Yeah,
but
just the fact that I don't know how many doctors actually provide their cell phone number.
Yeah.
You know, I get that you. Okay, so just so you know, you're not going to be calling constantly. You know, the doctor's home. They have lives too, right?
Yeah.
But it's nice to know that if there is truly an emergency, that you know there's somebody there that you can reach out to.
Yeah, well, we feel that that's important.
Yeah.
You know, people. You know, especially like I said, with our regular patients of record,
Yes.
they feel like family. You know what I mean? So I want to make sure that they're accommodated.
You know, I think you just answered a question that I'd asked you before.
Oh.
And that is, what is it that makes you, you know, kind of different?
Oh.
And, yeah, your
I
patients
hope
feel like
that's not
family.
different.
No,
anyway,
it's, you know what, it's not,
Yeah.
I don't think it's every dentist that is looking to have their patients feel like it's their family when they come in, right? Which really helps to, I think, keep people relaxed for something that really typically is a simple procedure, and I think people get things worked up in their minds, but, you know, it's nice when you can actually feel that way when you come in. So awesome. Okay, and what's something that people don't know about your practice, about your business? Is there anything that you think that people might not know that you might want to share? Maybe actually, I can think of at least one, and that is the phone number, right?
Oh,
right.
well.
Right. We don't want to, right? But I'm just saying that it's something that people wouldn't know necessarily. No. Okay, so open book.
Yeah.
Great. Okay. It's okay. I mean, we don't have to answer all of these questions. We're just kind of going through the list here of things that we might think are pertinent to you. So, let's see here. So, what's your most memorable experience working with a patient?
Well, it's mostly with, I think, patients that are, you know, say missing a lot of teeth or whatever, and we can make some sort of replacement. And when they see them, they sometimes get emotional. You know, they say, oh, you know, I'm so happy now. You know, I can go in public and smile and speak and not be self-conscious, you know.
Their confidence is kind of built up a bit because they have,
that, and you know, if patients come in pain or whatever, and they're, like you said, they can be nervous or whatever, and we take care of them, they walk out of here not in pain, and that's sort of, you know, that makes me happy.
Yeah, I could definitely see that. So what are the services that you provide?
Well, just, you know, we do the basic services, the cleanings, the regular cleanings, checkups, fillings, extractions. We do some, well, like with cosmetic stuff, it's mostly tooth whitening, you know, things like that.
Right.
We don't really push that. If the patient asks us about it, you know what I mean? Our basic thing is take care of the patient's needs, you know? we do have nitrous oxide, which is the laughing gas,
Yes.
you know, to help certain people
Wow,
that
you
might
know,
be a little bit nervous.
not every dentist has that
Yeah.
now, I find. More, you know.
Yeah.
It's nice
So
to know that they still do that.
we do that, and then there are plenty of very good specialists here in town. So if something gets over my head, or is, you know,
Yes.
really challenging, or you know, there are plenty of good specialists here in town that we refer to as well. So.
Okay,
Yeah.
great. All right, and is there any advice that you might give to other people who are looking at either starting their own business or they have their own business already? Any advice that you might want to give them?
For here in Milton in particular,
Anywhere.
or
Anywhere.
Well, just like I said, I just got overwhelmed with all the regulations that, you know,
Mhm.
the government regulations, and they change, of course, all the time.
Yes.
And trying to keep up with it is almost a full-time job just in and of itself. So,
Right. So be prepared
yes,
for that kind of thing.
be prepared, and
Yeah.
like I said, it's a great town.
Yeah.
You know,
Yeah.
I've loved being here for 20 years. It's
What's your
the
favorite place
people
to
are
go?
great.
Anywhere that you would suggest that's your favorite place
Well,
to go?
I don't want to
or-
say, you know,
Ah,
but
yeah,
you know, there
I know.
are some nice restaurants
Places
here
that you
along Main Street.
recommend, okay,
Yes,
yeah.
you know, you know, that's about it. I don't want to
Oh, that's
say
okay.
anything, you know,
I
but-
know. I get that. Probably a few favorites, but
Yeah,
you know, there are so many. Really, it's hard to kind of choose from them. But tell you what, can we take a quick tour of your office? Would you mind
Sure.
bringing us around?
Yeah.
Quick. I mean, reception.
Reception area, a little consultation room. Sorry.
Oh yeah, yeah. Hey, they've got fish. Want to keep you.
Cavity-free wall of fame.
And a place for the kids to play as well.
Yeah.
So that keeps them. Oh, look at that! Look at the cavity-free wall of fame. That's a great idea. Great.
A little
Consultation
consultation
room.
area. You can show patients
Sure.
their, you know, X-rays, things like
Yeah.
that.
Yeah. Don't think we need a tour of the bathroom.
And we have our Panorex machine here. Which is
Okay.
one of those X-rays that goes right
Great.
around your head.
Yeah. You
Wow.
do panoramic X-rays right here. Great.
And we have 4 operatories. So this is a hygienist operatory. Right here, one of the hygienists.
Great. Okay.
That means this here.
Great.
It's nice we get the view of outside.
Yes.
Too,
And
It's
oh,
nice
look at the
they can't
ceiling!
see-
Look
yeah.
at the ceiling! Look up! Look up! There we go. Wow! There's a fish tank on the ceiling.
That's cool. Look, it's in
Great.
that ceiling too.
Yeah.
and this is one of
Yeah,
my
that's right.
operatories
One of your
here.
operatories, right.
Yeah. Our sterilization area.
Right. So because we have to make sure everything is
Oh yes.
extremely sanitized and
Yes.
yeah.
Two
Fantastic.
machines to sterilize things.
Yeah.
And then the other room back here. That's all. So
All
it's-
right.
Yeah.
Another. I love the fish.
Yeah, patients like this when they're lying back, they
Yes,
can
exactly.
see them. And,
Something else to stare at beside the tiles on the
yeah.
wall. That's great.
That's fantastic.
All right. So, well, I think that's, let's say hello to Themi because she's been hiding this whole time. Hello, Themi. How are you?
Good, thank you.
Great.
Yeah.
And you've been a dental hygienist for how long? Have you been?
Since 1994.
Since 94.
Yeah.
Wow. Awesome.
Mm-hmm.
So, you know, it's nice to be able to be in a place that, you know, offers such a comforting feeling to the patients and so on. And anyway, great to see a hygienist working here.
Love it.
Almost became a hygienist instead of a realtor. Now. Anyway, well, thank you very much.
Thank you. Thank
All
you.
right. All right. So we're good. I think that we've had a great tour of the office here and to know a little bit more about Dr. Ted and Themi and their practice. And I think that's it. We're going to say goodbye at this point in time.
Bye-bye.
And take care. Have a great day.